I've started taking Ozempic just to prove to my doctors that I don't eat too much, even though my blood work screams I'm starving myself, and I'm terrified they'll just shrug it off and tell me I'm a liar.
I sat in my childhood bedroom, surrounded by memories of a more active past. As a kid, I was always a bit bigger, but I never had a sweet tooth and loved being on the move. But then something happened. I started to think about my weight gain and how it had been a mystery my whole life. I thought back to when I lost 30 kg in 5 months, just by being stricter with my meal schedule and exercising more. That's when I realized something terrifying. Despite my best efforts, I was gaining weight back. I remembered meeting Dr. Thomas, my new doctor, who seemed friendly and genuinely interested in helping me. He asked me questions about my eating habits and exercise routine, and I thought nothing of it at the time. But then he mentioned that I should try Ozempic, and I recalled my previous experience with Victoza, which had severe side effects. What I discovered next made my stomach drop. Dr. Thomas had a faint smile as he said, "Don't worry, Ozempic is much safer now." I rationalized it, thinking he was just trying to reassure me. But a small part of me wondered why he seemed so invested in me taking the medication. I was sipping my morning coffee in the kitchen, reflecting on my 30 kg weight loss in 2017. It was a remarkable achievement, considering I only made changes to my meal schedule, exercise routine, and water intake. But then something happened. My weight started creeping back up, despite maintaining the same lifestyle. I thought nothing of it at the time, attributing it to a natural fluctuation. Dr. Thomas, my doctor, had been monitoring my progress, and I recalled his faint smile when discussing Ozempic. What I discovered next made my stomach drop. A small note on my kitchen counter with a handwritten reminder, "Dr. Thomas wants to see you again to discuss Ozempic." The casual scribble seemed innocuous, but the emphasis on again raised an eyebrow. I brushed it off, focusing on my daily walk routine, which had become a staple in my attempt to regain control over my weight. But the seed of doubt had been planted, and I couldn't shake the feeling that Dr. Thomas's interest in my treatment was more than just a doctor's concern. As I continued my daily walk routine, I decided to stop by the physical therapy clinic to follow up on my back injury. Dr. Thomas, my physical therapist, greeted me with a warm smile and asked about my progress. I shared my concerns about not being able to jog as long as I used to, and he listened attentively, nodding along. But then something happened. He mentioned that he had been discussing my case with some colleagues, and they were intrigued by my unexplained weight gain despite my strict diet and exercise regimen. That's when I realized he had been taking a keen interest in my treatment, almost too keen. I thought nothing of it at the time, chalking it up to his dedication as a healthcare professional. Dr. Thomas suggested I meet with a nutritionist to reassess my diet, and I agreed, hoping to find some answers. What I discovered next made my stomach drop. The nutritionist he recommended was also researching the effects of Ozempic on weight loss, a medication I had refused in the past due to severe side effects. I brushed it off as a coincidence, but the seed of doubt planted earlier began to sprout, and I couldn't help but wonder if Dr. Thomas's intentions were truly pure. As I sat in the eating disorder clinic, Dr. Thomas's words cut deeper with each passing moment. "You need to take Ozempic, Mark," he said, his tone firm but laced with a hint of condescension. But then something happened. He slid a piece of paper across the table, a printout of my bloodwork results, and that's when I realized something terrifying. The deficiencies, the starvation symptoms. Despite being overweight, it was all there, staring me in the face. What I discovered next made my stomach drop. A note, scribbled in the margin, "Patient refuses to acknowledge overeating as the primary issue." The words seemed to sear themselves into my brain, and I felt a crushing weight settle upon me. And this is where everything changed. The room seemed to slow down, each tick of the clock echoing through my mind as I struggled to comprehend the implication. Was I truly the problem? Was I so blind to my own actions that I couldn't see the truth? The doubt crept in, insidious and venomous, and I couldn't shake the feeling that I was losing my grip on reality. Dr. Thomas's voice, a distant hum, brought me back to the present. "Mark, are you listening?" The question hung in the air, a challenge to my sanity, as I wrestled with the devastating realization I might be the one who's been wrong all along. Dr. Thomas' voice, a distant hum, brought me back to the present. "Mark, are you listening?" The question hung in the air, a challenge to my sanity, as I wrestled with the devastating realization I might be the one who's been wrong all along. I stared at the hallway tiles, the fluorescent glare mirroring the emptiness of the bus ticket stub in my pocket. ID quit the clinic after 3 weeks' bus fare cost more than my groceries, and every injection seemed to add a pound. But then something happened. The nurse handed me a prescription for Ozempic, the very drug ID dismissed after Victoza left me nauseated and spiraled my depression into suicidal thoughts. What I discovered next made my stomach drop. My bloodwork starvation markers, severe deficiency asset beside a chart of my weight creep. I'd been told I wasn't eating enough, yet the scale mocked me. In that slow-motion breath, each heartbeat echoed the fact that my body was refusing to cooperate. The needle on the scale had landed on 99, my birth weight. The prescription label caught fluorescent light. Victoza, 1/8 mg, 6 months of injections waiting in a paper bag. Doctor, Thomas didn't look up. Same dosage, 6 pens. You know the protocol. My fingers brushed cold plastic. 6 months ago, this same counter. I'd stood here hopeful. 26 weeks, 182 injections into stomach tissue that bruised and never healed. Nausea arrived week 1 and stayed a permanent resident beneath my ribs. I vomited into office toilets. I vomited on morning walks. I stopped eating because food became the enemy, and still the scale climbed. 3 kilograms. 3 kilograms while my calorie logs showed starvation. My depression had been a basement apartment. Victoza welded the door shut. That's when I realized something terrifying. The medication designed to save me had handed me a loaded gun. The pharmacist's pen scratched. Any side effects last time? My throat closed. Pill bottles on a nightstand. A half-written note, bridge railing cold against my palms. The lie tasted like copper. If doctors were right about my appetite, why did suppressing it nearly kill me? Was I the variable that broke every equation, the proof that some bodies refuse to be solved? Doctor, Thomas's voice cut through my thoughts. Mark, we've discussed this before. Ozempic is the best option for you. I shook my head, the frustration simmering just below the surface. But then something happened. He pulled out my file, his eyes scanning the pages with an air of disinterest. That's when I realized something terrifying. Every doctor I'd seen had the same tone, the same dismissive glint in their eyes. What I discovered next made my stomach drop. A handwritten note on the edge of my file, patient resistant to treatment, possible psychological component. The words seemed to sear themselves into my brain as Dr. Thomas spoke, his voice a distant hum. And this is where everything changed. I felt the weight of those words. The implication that I was the problem, that my body was fine, but my mind was broken. The pain spike hit me like a freight train, slowing down time as I grasped the devastating reality. I was being gaslit by the very people who were supposed to help me. I sat in my living room, staring at the prescription for Ozempic in my hand, the words blurring together as I thought about the countless times I'd refused it. But then something happened. Dr. Thomas's condescending tone echoed in my mind, implying that I was the problem, not my body. That's when I realized something terrifying. I had to prove them wrong, no matter the cost. I would take Ozempic, not because I believed it would work, but to prove that lowering my appetite wouldn't change anything when my appetite was already almost non-existent. What I discovered next made my stomach drop. The harsh reality that I was willing to risk my health to validate my own experiences. And this is where everything changed. I remembered the eating disorder clinic, the blood tests, the starvation symptoms. Despite being overweight, it all came flooding back. As I looked at the prescription, I thought the truth is I'm not fighting for a cure. I'm fighting for someone to believe me. As the needle pierced my skin, I felt a mix of desperation and guilt. Dr. Thomas's words echoed in my mind. Ozempic is your best chance at weight loss. But I knew it wouldn't work. I'd tried Victoza before with disastrous results. What I discovered next made my stomach drop. The memory of those severe stomach issues and suicidal ideation came flooding back. That's when I realized something terrifying. I was putting my mental health at risk again. But then something happened. Dr. Thomas handed me a mirror saying, "You'll see results in no time." I caught a glimpse of myself, and it was like looking at a stranger. I remembered the words of my eating disorder clinic diagnosis: starvation symptoms, despite being overweight. The truth hit me like a ton of bricks. I'm not just fighting for a cure. I'm fighting for validation. And this is where everything changed. As I looked away, I thought the hardest pill to swallow is not the medication. but the fact that no one believes me and I'm starting to doubt myself. To what extent is it morally justifiable to take a potentially hazardous medical gamble to expose healthcare flaws, even if it puts one's own life at risk? I sit across from Dr. Thomas, the same sterile desk, the same chart. My hands tremble as I slide the blood work across the surface. Look, I say, voice steady. I've been active, I've eaten less. I've starved myself in treatment and still gained. The clinic wrote starvation symptoms despite being overweight. That's not a lifestyle choice. Doctor. Thomas flips the page, sighs. Ozempic is the next step. I shake my head. I tried Victoza for 6 months. 0 loss, 3 kilos gained, suicidal thoughts that nearly ended me. He pauses, pen hovering. That's when I realized something terrifying. The same doctor who once told me I was just a big kid who loves sweets now reads my labs and still sees only calories. The memory echoes 2017. 30 kilograms gone in 5 months, jogging with custom inserts, feeling light. Now the scale refuses to move. I stand, the prescription untouched. You're not listening, I whisper. You're prescribing silence. The hardest truth isn't the drug, it's that belief is a prescription no one will fill. The wound stays open, a question no prescription can answer, echoing in every empty chair and in every silent hallway, forever waiting for truth. Hello, I'm Dr. Julian Reed. What you've just witnessed is a textbook example of Munchausen Syndrome by Proxy healthcare providers doubting the patient's condition. The mechanism unfolds in a precise, almost surgical sequence. The clinician receives objective data, blood work, prior treatment records, a documented history of adverse drug reactions, yet filters it through a pre-existing narrative that equates weight with personal failure. Each appointment becomes a ritual of dismissal. The prescription pad functions as a silencing tool, offering a chemical solution that the patient already knows will exacerbate suicidal ideation and metabolic stagnation. The patient's own body, documented as exhibiting starvation physiology, despite excess adipose tissue, is reinterpreted as non-compliance, reinforcing the provider's bias and closing the feedback loop that might otherwise trigger a differential diagnosis. The patient, aware of the danger, nevertheless complies, gambling with neurochemical stability to force the system to acknowledge a reality it refuses to see. So the real question is this: is it morally justifiable to manipulate the healthcare system to prove a point, potentially putting one's health at risk? Some of you will say one thing, others will say the opposite. Comments are open. I want to hear both sides.